Johnson & Johnson vaccines are still on hold in Georgia and across the country as the FDA and CDC investigate rare cases of blood clots in 6 different people they've confirmed. An advisory panel for the CDC is expected to meet again next week to recommend some next steps here. But there is growing concern that the longer the vaccines are paused, the more it could feed into vaccine hesitancy. Naima Abdullahi reports.
After the FDA and the CDC recommended Tuesday that providers pause Johnson & Johnson vaccinations, questions surfaced, heightening ongoing concerns about vaccine hesitancy. Mark Tompkins, professor of infectious diseases at the University of Georgia, says it's best to pay attention to the factual data.
While vaccines are not risk-free, they are incredibly safe. Just, the numbers don't lie that the likelihood of having a serious adverse event from any vaccine is incredibly low.
According to the CDC, nearly 7 million Johnson & Johnson vaccines have been administered nationwide, but they've now been halted after reports. 6 women between the ages of 18 and 48 developed blood clots.
We see some blood clots in the small number of people that receive the vaccine. It suggests maybe there's something going on there. We don't know for certain, and so we call it a signal of something going on.
ER physician Mehrdad Ertashami says some people were already concerned with how quickly the vaccines were developed and whether they're safe. He knows the headlines this week are heightening the fears.
Now, first of all, I completely understand how complex this issue is. That what we have asked people to do over the past year is to take a very complicated issue, such as a disease that has resulted in economic hardships, and for them to kind of make sense of it. And that's a hard thing to do.
However, he says vaccination is still the best option on the table.
Vaccination is of the utmost importance.
Emergency physician Michelle Wan and physician's assistant Natalie Schmidt, both from Viral Solutions, say that the key to decreasing hesitation is transparency and educating people about the vaccines, including Moderna and Pfizer, which are still available in Georgia right now.
We're right at the finish line. We're very close to it. All we need to do is hang on a little bit longer.
I think this is our ticket out of this pandemic, or at least controlling it.
There is so much new information all the time about the COVID-19 vaccines. You can find it all on 11alive.com. We do updates for you there every day.